and figure of Radiology Center, and to congratulate Dr. Sahar Al-Fai'i as a chairperson for this important and outstanding department in Ain Shams University, the Department of Radiology. I have the honor to present Professor Nora Nabil, will present the role of PET scan in evaluation and prognosis of hepatic focal lesion, as well as its impact and treatment strategy. Dr. Minna.
Good morning, dear professors and colleagues. Today we are going to present the role of PET scan in the evaluation and prognosis of hepatic focal lesions, as well as its impact on a treatment strategy. First of all, the usefulness of PET-CT established for assessment of disease staging, detection of early disease recurrence, therapeutic evaluation, predicting prognosis in various malignancies, and evaluating the spread of inflammation. Normally, this is the figure of normal hepatocyte or a normal cell. Normally, the FDG is the analog of the glucose used in our tracer activity of PET, taken by the glucose transporter into the cell. FDG is phosphorylated by the hexokinase enzyme to an FDG glucose 6-phosphate. Normally, the FDG 6-phosphate underwent no glycolysis, otherwise underwent by the glucose 6-phosphatase enzyme into FDG again and released outside the cell. In case if there is pathology in the cell, like tumor or infection, this glucose 6-phosphatase become disrupted, result in FDG 6-phosphate accumulation, translated in our molecular imaging by increased metabolic activity and increased SV values. Okay, we will, by different cases illustration, hint the importance of the PET-CT in the liver lesions. First of all, role of PET-CT in detection of metabolic active lesions. Case 1, we have here a patient, 57 years old male patient. As we see here, there is a bilobar metabolic active hepatic focal lesion seen scattered at different segment levels of known case of bilateral adrenal high-grade metastatic neuroendocrine tumors. Here we see that the PET-CT also detect and also we can measure the SV value. It becomes 13 compared to the normal liver, which is SV max of 1.5. The same patient with different cut levels, we can also illustrate that there is 2 hepatic focal lesions seen. As we see here in the CT, there is no appreciable lesion found by the CT alone. When we combine the PET-CT here, we can see avid FDG activity by the tracer, and also here there is also other segment of FDG seen in segment 4B. Another case, a 46 years old female patient, known case of bilateral breast cancer, presented with extra breast bilobar metabolically active hepatic focal lesions. So here the PET-CT has important in detection of these hepatic focal lesions with increase the SV value. And as we see here, there is a very faint lesion couldn't well visualized by the CT alone. When we combine this by PET, we here see avid hepatic focal lesion seen at this PET-CT study. Another role of PET-CT in the prognosis of the focal lesions. This is a case of a male patient, lymphoma. This patient, this is the old study. There is no focal lesion seen in the initial study. When the follow-up is underwent by our department, we here see that a new focal lesion developed in the segment 8 with avid increased metabolic activity. The same patient with other cuts of the liver. We also hear the initial study there is no focal lesions. In the follow-up study there is a detected new focal lesion of the liver with avid increased the SV max of this hepatic focal lesion. Another case to see the importance of the PET-CT in the prognosis. Here we have the same patient of cancer colon, underwent surgical resection. This is two CT done at different dates. This is the old one and this is the new one. As we see here, the old one and the new one, we can see a hepatic focal lesion seen segment 7 with the same size, there is no change. If we satisfied only by this CT, we could write in our report stationary course as regard disease process. But when the patient did this PET CT, we here see the same lesion at the same site, but we see here a focal increased avidity of the hepatic focal lesion. Become here 8 compared to 4, which upgrade the condition and become not just a stationary course, but become prognosis, bad prognosis or progression of the disease process. Okay, role of PET-CT also in tumor differentiation. For example, we take the metastatic neuroendocrine tumors. According to the grade of differentiation, neuroendocrine tumors are classified according to well-differentiated, moderately differentiated, and poorly differentiated. FDG accumulation is significantly higher in poorly differentiated tumors than in well and moderately differentiated. We can have a case done in our department for illustration. Here is a case, a female patient, known pancreatic neuroendocrine tumor. We see here a focal hepatic lesion seen at segment 6. This, when we did the PET-CT, there is no appreciable FDG activity, which could write that is morely toward the well differentiation. Another cases to illustrate this point. We have here a male patient have a liver cirrhosis, diagnosed hepatitis C virus with hepatic focal lesion by our conventional imaging and by laboratory examination. We could see hardly here a hepatic focal lesion. By the PET here, we know there is no appreciable FDG activity, which is meant that the lesion is toward the good differentiation. Another case of liver cirrhosis with hepatic focal lesion HCC. Here is a hepatic focal lesion seen bulging outside the liver contour. This lesion show moderately increase in FDG activity, which proven to be a moderately differentiated HCC. Okay, last case to discuss such point of differentiation. We have here a CT of the patient known liver cirrhosis with multiple hepatic focal lesions proven to be HCC. By PET-CT study, we see here a multicenteric HCC which has increased metabolic activity. So here this HCC is for the poor differentiation. Intrahepatic cholangiocarcinoma is the second most common primary liver neoplasm after HCC. They are classified into a peripheral type and perihilar type according to the location, and mass forming or infiltrating type according to their morphology. This is a study. We have two rows. The first row, we see here a mass forming lesion enhancing an aportovenous phase with capsular retraction. On figure B, this is T2 hypointense lesion with a peripheral enhancement. On a PET-CT study, we here see that lesion have increased FDG avidity. Intrahepatic cholangiocarcinoma, the hilar type, we here see ill-defined lesions in CT study show enhancement with dilatation of the peripheral ducts. On a T2, the lesion is still hypointense. On the FDG, the lesion has no increased avid activity. This is proven by the biopsy, and this was intrahepatic cholangiocarcinoma peripheral type, and this is perihilar type. This owing to the difference in the enzymes of hexokinase and G6PD. According to this difference, this type of the cholangiocarcinoma show avidity increase uptake, and this is no. Malignant lymphoma. Malignant lymphoma, as we know, divided into Hodgkin and non-Hodgkin lymphomas. Secondary hepatic involvement by lymphoma is common, especially in patients with a non-Hodgkin lymphoma. We have also here a case. This patient, when we did CT alone, we just see hepatosplenomegaly. But when we did PET examination, we here see diffuse enlargement and diffuse infiltration with increased metabolic activity of both liver and spleen. And by MEP study, we show diffuse marrow infiltration. This patient proved to be lymphoma. Another important role of PET-CT in assessment of post-interventional treatment of HCC. PET-CT show higher accuracy in assessment of intervention bed without affection by lipido artifact and also detection of extrahepatic spread of HCC. In our department, most clinicians, before doing the liver transplantation, they come routinely in our department for PET assessment before doing liver to see if there is any extrahepatic metastasis of the HCC. It will affect the treatment strategy. Here we will discuss the importance of the lipidol. Here, as we see, the CT non-injected male patient due to high serum creat level, there is a lipidol artifact seen at segment 8. We didn't know that the patient has residual lesion or recurrence lesion here. When we do the PET examination, here we see a focal intense avidity near to the lipidol, and here we suggest that the management either incorrect or there is a residual lesion or recurrence according to the duration of the procedures. Another case to illustrate the importance of the PET. Here we see the lipidol only in CT examination. After PET, we see a multiple hepatic focal lesion among this lipidol, which is meant that this lipidol is not done accurately or there is a recurrence residual in such lesions. Thank you.
شكرا دكتورة نورة. Second presentation